The World Health Organization says the death toll from the Ebola epidemic is continuing to rise, as well as the infections. 2 potential Bundibugyo vaccines are in the early stages of clinical trials on humans, while a third is being worked on to bring it to that stage. Around 87% of cases in the DRC outbreak are in the northeastern Ituri province, with 11% in neighboring North Kivu. Here is our cover report. The latest Ebola outbreak in the Democratic Republic of Congo began at least 3 months before it was officially declared, meaning the health authorities are still playing catch-up. And that's a warning from the World Health Organization. More than 1,900 people have died from the virus since that declaration on May 15th, making this the second worst Ebola outbreak ever. Infection rates are still high, adding to the concern that the authorities are struggling to get to grips with the spread of the disease. The epicenter of this outbreak of the Bundibugyo species of Ebola is in the east of Congo, where insecurity has hampered control efforts. There is also no approved vaccine or any recognized therapeutic drugs, making treating Bundibugyo harder.
Very important. We don't have a licensed vaccine, neither therapeutics. So if we expect this Ebola to be the same way we did in Bulape, no. And other factors which you know. Insecurity, places where we cannot reach, we are only seeing 30%, where the 70%, people dying at home. This is why this Ebola is different.
Traditional burial practices where mourners touch the deceased's body and a suspicion of health authorities in some communities have also made things difficult. But there are now several dedicated treatment centers in the east of the Democratic Republic of Congo, and people are getting diagnosed much more quickly. So far, there have been 4,294 confirmed cases and 1,960 deaths. The largest recorded outbreak was in West Africa between 2014 and 2016, when 11,325 people died. Congolese authorities are carrying out Ebola and cholera screening for all 255 passengers aboard a boat intercepted on the Congo River. The Yingfei 2, operated by a Chinese company, was halted near Bende Port, some 65 kilometers upstream from the capital, Kinshasa. But there's a little ray of hope on the horizon.
So having people who recover tells us 2 things. 5 people are likely also to recover, and we can do more. We can do more. We can scale up optimized intensive care.
Next door in Uganda, a country that also reported infections in May, the picture is entirely different. The country's health minister described a moment of joy as the last Ebola patient was released from hospital 2 weeks ago. Uganda only ever recorded 20 cases and 2 deaths from the virus.
If you have systems where you can do early diagnosis and patients come into your care early enough, then they can be treated and they are cured of Ebola disease. The 2 cases that died, the issue was they presented late when they had developed severe complications like bleeding and so forth. So meaning our systems should have capacity to do early detection, early diagnosis, and then early treatment.
The Gavi Global Vaccine Alliance maintains a stockpile of 500,000 Ervebo doses. It says doses from the stockpile were to be made available for the trials, with some already in the DRC. Africa Bureau, WION, World is One.